everyone, and welcome to one interesting podcast. Who better than our very own, the liver specialist, Dr. Vivek? I welcome you to the podcast. What is a liver transplant?
Liver transplant is like changing the engine in a car. You cut your hair will grow. You cut your hand or a limb or a leg, it never grows. That is how important the liver is. ரொம்ப கிளாசிக்கலாக சொல்லுவாங்க, I know so many people பச்சை காலமாக தண்ணி அடிச்சுட்டு இருக்கோம், எங்களுக்கு ஒன்றும் ஆகாது, nothing happens to me. Nothing will happen.
There's actually a very big myth that's being broken right now.
Transplanted farmers who've gone back to farming, இறங்கி வேலை பண்ணுறவங்களாம் இருக்கிறாங்க.
Liver transplant, these three indicators.
That's such a slightly difficult question to answer. 5 years கழிச்சு தேவைப்பட போகுது, அது இப்பே பண்ணிக்கிட்டா என்ன?
First, I want to understand who all are eligible for donating.
So it's 18 to 50.
Hello everyone, and welcome to one interesting podcast. Liver, a very important part of the body. School la படிச்சதோட சரி, but what about the liver health? How do you maintain it? Liver transplant na அடிக்கடி கேக்குறோம், relatives, friends and everyone, but what is liver transplant? Let's decode everything about this liver transplant in today's episode with who better than our very own, the liver specialist, Dr. Vivek. I welcome you to the podcast. How are you, sir? And thank you so much for joining, first of all.
Thank you.
Yeah.
Lovely to be here.
Yeah.
For the second time, I think.
Yes.
Yeah.
So, as we were talking, first of all, welcome. And thank you so much for joining, doctor. How are you?
I'm very good. How are you?
I'm good. I always love asking doctors, how are you? So, doctor, I know like a lot of people, especially my age, and when I see around liver transplant அப்படின்னு சொல்லும் போது, I only hear like இந்த சொந்தக்காரங்களுக்கு liver transplant பண்ணிருக்காங்க, or their liver health is down and all those things. But if you had to decode that for common man, எனக்கு புரியணும், இல்லை என் வயசில் இருக்கிறவங்க யாருக்காச்சும் புரியணும்னா, what is a liver transplant?
Liver transplant is like changing the engine in a car. As simple as that.
Okay.
There are multiple parts in a car, but the engine is one of the most important parts which can be changed, of course, if it goes funny. So a transplant is where you remove the old engine and put a new engine. Okay. Likewise, you remove the old liver and put a new liver is what transplant is all about. Okay. So there are various indications for a transplant. When do we do a transplant? Does everyone need a transplant? When do we not do a transplant? Of course, the science has given us enough of evidence today, and we all go by that evidence and save a lot of people. Now, the liver is, I think I've over and over again I've told this, and it's an amazing organ. It's got some amazing properties. Okay, it is the only organ in the human body which can regenerate.
Yeah.
Okay.
Can repair itself.
Repair is another term. Regenerate is a separate term.
Okay. Explain that.
So say for example, we drink alcohol.
Yeah.
Okay. The liver gets damaged. You stop alcohol. The liver will repair itself. Okay. Which means the dead cells are all thrown away and new cells appear. Correct. Okay. That is a repair capacity. Okay. While a regenerative capacity is the liver to grow back. Okay, so if a liver which is about 1.5 to 1.2 to 1.5 kilograms, you just divide half of it and throw it away. Okay, in about 3 weeks' time, the liver can grow back to its normal shape and size. Okay, so you cut your nails, the nails will grow.
Exactly.
You cut your hair will grow.
Right.
You cut your hand or a limb or a leg, it never grows. You cut your intestines, it never grows. You cut any of your bone, it never grows. Okay, no organ will grow back. Okay, that is how important the liver is. Okay, it's like a tree growing back. It's amazing to see. When we do serial scans after liver surgery, you can see the liver grow back and attain its original shape and size.
Right.
That is how important that organ is. So lots of diseases does affect this liver. It could be alcohol, it could be viral hepatitis, it could be fat in the liver, which is very very common these days. It could be any poisons, toxins, diseases which come in families, so on and so forth. Okay, but you only need a transplant when about 60-70% of the function is lost. Okay, until then, of course, most important thing is we get to know that we have a liver disease only when at least 50% of the function is lost.
Oh.
Okay. Say, for example, jaundice
Okay.
is one of the first symptom. Leg swelling is another symptom. Tummy swelling is another symptom. Vomiting of blood is another symptom. All these things happen only when 50% of the function is lost. Until then, we will never get to know. Okay. ரொம்ப கிளாசிக்கலாக சொல்லுவாங்க, I know so many people வருஷ காலமாக தண்ணி அடிச்சுட்டு இருக்கிறோம், எங்களுக்கு ஒன்றும் ஆகாது, nothing happens to me. Nothing will happen. Okay, until that one day when the liver decides enough is enough. Okay, likewise viral hepatitis. I've known enough of people who know that they harbor the virus in the body, okay, but never seek treatment. Okay, the liver will just wait for a long time. It's a quite resilient organ. Okay, எதையும் தாங்கும் உறுப்பு அது. It just wait for a long time, but then one fine day it'll say enough is enough, I'm tired of its nonsense. Okay, that's when the liver starts failing, and that's when symptoms starts appearing.
Okay. So one question here is, when we say that 50% damage aara varikunda, we at least see all these symptoms.
Yeah.
On an average, I know this might differ, but how long does it take for a person even to reach that 50% threshold damage?
So it depends on the amount of abuse on that liver. Of course, when I say abuse, it can be alcohol abuse, it can be even food. No, I think we should use the term food abuse.
Yeah.
Right. I mean,
Absolutely.
we just gone crazy. I don't know if you guys come to Ananagar, and of course people from outside India should know Ananagar in Chennai.
Yeah.
It's a huge food court.
Yes.
All the streets have
Every
got,
street is a food street now.
Every street is a food street, and you get food up till 2 a.m., 3 a.m. in the morning.
Yeah.
That's crazy. People have gone bonkers, and they've not even thinking about the health and their lifestyle. So food abuse is another huge thing that is happening. Alcohol abuse. Sorry, I missed your question.
Yeah. How, on an average,
Right.
how much time does it take?
So it in an average it takes about 20 years, 15 to 20 years on an average. Okay, for someone who is drinking every day,
Got it.
say 180 ml, which is a quarter of alcohol.
Right.
That's what you get in Taskmarks these days. It takes about 15 years.
Oh.
It's a long time.
It's a long
It's
time.
a long time.
And
Likewise, a virus, hepatitis C virus, will take about 20 years on an average. Okay. Hepatitis B virus will take slightly longer.
Okay.
Right? Congenital disease,
Okay.
will take 20, 25 years, 30 years. Disease which are running in families.
Wow.
For example, Wilson's disease, which is a defect in copper. There is hemochromatosis, which is a defect in iron metabolism. All these things will about 25, 30 years. But having said that, if someone's gone mad and been drinking every day from morning to evening, things will go haywire in about 5 years even. We've seen that happen.
Because now that you mentioned the time period, okay, average I'm assuming 15 years. Going into some rough statistics over the years, let me compare, we are in 2024. So 2004 to 2024, how big of an increase have you seen in the number of patients who come for a liver transplant?
I think the demand has always been there.
Okay.
The difference enna appadina vandu, in 2004 the number of transplant surgeons and the transplant units across the country was very very less. Okay, but now there are lots and lots of doctors who trained and come back and started transplants. Now the most important thing is the age at which transplant is happening.
Okay.
That is most important thing, because what I've realized, or what in my experience I've seen, is that I've been in this country for about 18-19 years now, and those days we used to see in the 50s.
Yeah.
Okay, 50s, 60s, because they've been drinking from 30s, and then they come to transplant at 50 years of age. But now we are seeing in the early 30s. which means
People have started drinking in their
earlier,
20s.
correct.
Or even before the
Even
legal
before that.
drinking age
Absolutely.
to consider.
Absolutely. So the demand for transplant has always been there, and rough statistics say that at any one time, at least 2 lakh people need a liver transplant at any one time. In India, on an average, we do about 3,000 to 4,000 transplants in a year. So the skew is always there. Okay, the demand is huge, the supply is very, very small. Okay, and it keeps growing by the day with the amount of alcohol and food and diabetes that's all happening.
Okay. So, around about the liver transplant also, I think there are a lot of myths revolving it. To an extent that namlum ketripom that people come and they're like, liver transplant panna, you're not going to live for long.
Correct.
Okay, you might actually die. Don't do a liver transplant. This is one of the common myths that even I've heard.
Correct.
So, what are some common questions that patients come and ask you if they have to do a liver transplant?
The first question they will ask is, how long will I live
Really?
after the transplant?
Okay.
Okay, because they have this notion that the liver can only survive for X number of years. Okay, so what I tell them is, if the transplant is successful, then you will live your biological age. Okay, which means if I do a transplant at 40, okay, and you're destined to live up till 75 years of age, you will get there. Okay, provided you lead a healthy lifestyle. Okay, so that is most important thing that people should understand. Okay, so நீங்கள் எவ்வளோ நாள் உயிரோடு இருக்கோ அவ்வளோ நாள் இருப்பீங்க டிரான்ஸ்பிளான்ட்டுக்கு அப்புறம். ஓகே, லாட் ஆஃப் பீப்புள் கம் அண்ட் டெல் மீ, இல்லை எங்கள் தாத்தா சொன்னார், எங்கள் மாமா சொன்னார், எங்கள் பக்கத்து வீட்டுக்காரர் சொன்னார், இந்த மாதிரி லிவர் பண்ணால் எப்படி செத்து போயிடுவாங்க, எதுக்கு பண்ணுறோம் அப்படிம்பாங்க. Because of course see, transplant is never a 100% successful operation. Okay, transplant never ever. It's a 90% successful operation, which is really good. Actually, if you see, it's far better than any of the cancer surgeries. Right, a 5-year survival for a pancreatic cancer is 40%. A 5-year survival for a liver transplant is 75 to 80%.
Got it.
காமன் டேர்ம்ஸில் சொன்னோன்னா 100 டிரான்ஸ்பிளான்ட் பண்ணால் 5 வருஷத்தில் 75 பேர் உயிரோடு இருக்க போகிறான். அதே 100 pancreas கேன்சர் பண்ணுறோம் அப்படின்னா 5 வருஷத்தில் 40 பேர் தான் உயிரோடு இருக்க போகிறான். That is true across all the cancers. So transplants are life-saving procedures. They give you better quality of life and better quantity of life. You live longer with a better quality. Provided you don't mess up with that liver again.
Absolutely.
As simple as that.
There's actually a very big myth that's being broken right now, is that because even ஒருத்தவங்களுக்கு கேன்சர் இருக்கும்போது அதெல்லாம் ஒன்றும் இல்லை, சரி ஆகிடும், நீ பாசிட்டிவாக இரு அப்படின்னு தான் சொல்லுவாங்க. பட் அதே when it's a liver health இல்லைனா liver transplant வரும்போது they are more worried, they are more scared.
Correct.
I really hope this reaches more and more people and this barrier of myth is actually broken.
Absolutely. So the results are really good when we do it on time.
Okay.
So மக்கள் அதுதான் பயப்படுறாங்க. People are just afraid that what is going to happen. You're only saying 10%. You're saying 10% of the failure. It is like they only see the negative things. ஒரு பெரிய white wall இருக்கு, அதில் ஒரு black dot இருக்குன்னா they only see the black dot.
100%.
They never see the white wall. Okay, so I always ask them the question back. Okay, நீங்க என்ன கேட்கணும் அப்படின்னா, what are the risks of doing the surgery? What are the risks of not doing the surgery? You should always look at both sides of the coin. Risk of not doing the surgery, there's a 100% chance that you're going to die if you got liver cirrhosis at some point. Okay, but if you do the surgery, there's only a 10% chance that you're not going to make it. There's a 90% chance that you will do very well.
Got it.
So I think that myth should go. When people do well with transplants, if the surgery is done well, if the timing of the surgery is well, if the quality of the organ is good, they do. I think there's enough of walking examples these days, where people just live for. Even in India, we have. In the first transplants and all which we did, it's about 15 years ago. They are still around, walking around. and they are productive. That's the most important thing.
Right.
It's not like surgery முடிஞ்சா வீட்டுக்குள்ளேயே இருக்கணும், you have to sit
Exactly,
at
and
home,
the bed
or
restலயே இருக்கணும் or something
we
like
need a sterile room, we need air conditioners, we need this, we need that. அப்படி இல்லாம we've transplanted farmers who've gone back to farming, இறங்கி வேலை பண்றவங்களா இருக்கிறாங்க. So I think that is very very important, that people should understand that transplant is not restrictive. It'll give back your life, you'll make your money, you'll have a normal life. We've had people who become fathers, we've had women who become mothers after transplants, we've had women who have delivered after donation of livers. So some amazing things have happened. So transplant is not a frightening thing these days. It's a run-of-the-mill surgery. It's like any appendix or hernia surgery these days.
From your perspective, how would you determine that if this patient is fit for a liver transplant or not?
So I think any surgeon who's doing a transplant has got a set of things. The first thing when I look at is when he comes through the door into my office, into my clinic, okay, how is he? Okay, is he frail? Is he skin and bone? Is he coming in a wheelchair? Is he coming in a stretcher? Okay, these are all eyeball, foot and or end of the bed assessments.
Okay.
So if someone can't even walk, is skin and bone, okay, is coming on a stretcher, or is already admitted in ICU and extremely unwell, okay, ivangallam we think twice before putting them through a transplant. Okay, but otherwise we, of course, it has to be objective. It cannot be subjective. Correct? Which means that I need to have evidence to suggest that this chap, patient A, patient B, can have a transplant, patient C cannot have a transplant. So we have a set of tests which has to be done. Primarily, what are the two most important organs for surgery is your heart and your lungs. Of course, the kidneys.
Right.
Okay. So if all these three organs are pristine, are really good, okay, we have some special tests to look into all these things, and if they are good, then we subject them through a transplant.
Okay.
These are the so it's very standard these days, very standardized across all the transplant units.
Got it. Key indicators or symptoms that suggest that liver transplant is necessary for a patient. Like we did speak earlier that 50 to 60% of liver health failure, and that's when you start vomiting blood and all those things. But liver transplant, these three indicators.
That's a slightly difficult question to answer,
Okay.
because it differs from patient to patient.
Okay.
Okay.
Makes sense.
So what is important is people should understand. I mean, a lot of people think that if ஒரு ஸ்கேன் பண்றாங்க, they do a CT scan or ultrasound scan and the liver shows irregularity, which means that they already have cirrhosis. It does not mean that they need a transplant straight away. Okay, cirrhosis or shrinkage of the liver is divided into two.
Okay.
One is compensated, one is decompensated.
Okay.
Compensated means the scan is abnormal, which means it's showing irregularity. Okay, but all the blood test is normal or near normal, and they don't have any complications.
Okay.
Which is no leg swelling, no abdominal swelling, no much of jaundice. They haven't vomited blood. They haven't gone confused with the raised ammonia levels.
Okay.
Okay, so they're all compensated cirrhosis patients. We don't do anything to them. We just closely monitor them. They should be on surveillance. At some point, they will tip into the decompensated group, which is when the complications develop. No, they're jaundiced. They have leg swelling, they have abdominal swelling, so on and so forth. Okay, இது மட்டும் இல்லாம, of course, the blood test all add up. Okay, so how is the jaundice levels? Okay, again, people need to understand that jaundice is not a disease.
Right.
It is a symptom that the liver is not working.
Right.
Okay, once you transplant the liver, the jaundice will just disappear.
Right.
Okay, so what are the jaundice levels? What is the protein levels in the body? Okay, what is the blood clotting parameter called INR? What are these levels? Okay, these all add up.
Okay.
Okay, இது இல்லாம there are one or two other parameters. For example, people who develop, we are transplanting for people who develop liver cancers also these days.
Oh.
Okay, so either all the blood tests normal but still they develop a liver cancer abdina, then we go and transplant these people. Okay, so it's really an individual based assessment. Okay, but there are some standardized metrics which we use. Okay, so that's the people, of course, the patient goes from hospital to hospital. What they that's a human tendency. They want someone to tell them that, oh, don't worry, we are going to sort you out without a surgery.
Common mindset.
Common mindset ಅದು, so they hop from hospital to hospital to find out what really it is. Okay, so one will say, oh, you need a transplant tomorrow. One will say, oh, let's wait for 6 months. Maybe another doctor will say, oh, let's not do this transplant at all. Why do this transplant? You don't need one. Okay, so இதெல்லாம் nullify பண்றதுக்கு there are certain parameters, there are certain scoring systems which you use called MELD scoring systems, which has stood the test of time. Okay, and we use these scoring systems to see which patients fit into the criteria. There's a good scientific evidence which is backed up by these scoring systems, and that we use to say, okay, you've reached the score, and at this point you would need a transplant. அப்படின்னு சொல்லுவோம். ஸோ அதை ஸ்டாண்டர்டைஸ் பண்ணணும். அது
It's not yet happened. The
well,
standardization.
some doctors do, some doctors don't, unfortunately. But I think it has to be used.
Okay.
Because I've seen enough number of patients even today who come and tell us, அந்த ஹாஸ்பிட்டலில் டாக்டர் ட்ரான்ஸ்பிளான்ட் பண்ணணும்னு சொன்னாங்களே அப்படிம்பாங்க. when you look at it, the bloods are all reasonably okay. So the one misconception is that 5 years கழிச்சு தேவைப்பட போகுது, அது இப்பயே பண்ணிக்கிட்டா என்ன அப்படின்னு ஒரு you might need it 5 years later.
Right.
But does not mean that you're going to have a transplant today. Your car tire can get punctured 5 years later, so that you don't keep changing tires, you don't keep changing engines. Only when there's a fault you look into it. Right, so there is nothing called preemptive transplant, there is nothing called preventive transplant. You don't do these things.
It's happening, preventive transplant.
It's possibly is happening, I have to say.
Okay, but it's good. I mean, I understand we don't have to get to the details, but at least for the viewers, they should know.
They should know,
before falling into a pit.
Absolutely.
So, and this system that I told,
MELD,
MELD,
model for end stage liver disease.
Okay, MELD. And as a patient, if I'm going to the doctor, it's important for me also know that there is a standardization, and if at all the doctor can follow that, better for the both of us, even for me to understand, even for them to understand.
Absolutely. They can do the MELD scoring. There's an app, you can just download the app, you can put your own blood test.
Okay.
It's so simple. In about 5 seconds it will give you the scoring. And you will know. So the scores range from 60 to 40. 6 to 40, sorry. Anything between 6 to 40 is liver disease. No, it's not normal. 6 is normal, 40 is the sickest of the patients. Okay.
Understood.
And as the liver disease progresses, the score keeps going from 7, 8, 9, 10, and when it crosses 15, it means that patient would need a transplant.
Makes sense. Okay. Just because we spoke about the app now, how do you think the technology has developed or the infrastructure has developed, especially with regards to liver transplant?
Liver transplant, the techniques are the same for the last, I think, 30, 40 years. Nothing much has changed. One person, the first one to do the transplant was Dr. Thomas Tassel in 1963. And since then, nothing major has changed. Of course, a few techniques have changed. The way we do transplants have changed a bit, but nothing dramatically. The principles are the same. Okay. So some do it laparoscopically, some do it robotically, some do it open method. Okay. But still we stick to the principles. We join the same vessels and bile ducts and bile pipes, So nothing much has changed, even technology wise.
Okay. Worldwide this is.
Worldwide. Yeah. Of course, a few medicines have changed. Okay. But otherwise, surgically, it's still about the same. One thing which is coming and going is machines which are being used to preserve livers. Of course, that's there in the Western world. It's used on a regular basis. Here, it is available here, but the perfect machine is not available. It's not cost effective. Those machines.
Okay.
It adds a lot of cost to the procedure.
Got it. And in the upcoming future, do you see there will be few changes that will be incorporated in the technology? At least like in the coming 10, 20
The cost
years?
needs to come down. Yeah, I think it will. I think it will. The cost has to come down for all these transplants,
Okay.
for technology to come in.
Okay.
Yeah, but what I really want to pitch in is preventive work. I think if we start preventive work today, i.e., prevent diabetes, prevent viral hepatitis, prevent alcoholic liver disease, prevent fatty liver disease, appada வந்து 20 years later, we'll see the fruit.
Right.
Otherwise, this community is screwed. Yeah.
Now, I want to get into a point of the conversation where I want to know after the liver transplant, how is it for the patient? So, what transition does he or she go through? What are the do's and don'ts? A little about that.
So, as I said, transplants are done to increase longevity and have a better quality of life.
Correct.
Okay. So, we always tell them be very careful during the first few months.
Okay.
Why? Because the immune suppression is quite high during that time. Okay. And we don't want to catch them any infection. Okay. And of course, especially if you walk on the road, you're bound to catch some infection or the other.
Okay.
So
Just by walking also, because you're inhaling the air?
absolutely, yeah, absolutely. No, it's a chance. So you go to a crowded place, you go to a temple, you're in a metro, you're in a cinema theater. You don't know what the person next to you is harboring. You don't know whether he's got tuberculosis or not. So we always ask them to be quite careful in the first few months after surgery,
Okay.
which patients do. After that, I always instruct them to get back to work by about 4-5 months time. Okay. One thing which I always tell them, at least in India, is that be careful with what you eat and what you drink. Okay, because water pollution, infected water, food is always trouble. Okay, that causes diarrhea, that causes fever, and once diarrhea happens, the immune suppression absorption changes, so on and so forth. It's a lot of hassle getting these things back to track again. Okay. So the infection is a huge problem in our country. So if patients don't have any infections, they are very safe, but still we encourage them to go back to work. We say you have to get the idea of transplant is getting them back to normal.
Correct.
And not sitting in an AC room and drinking mineral water and eating sterilized food. No, that's
And
not the
like
idea.
you mentioned, farmers have also got liver
Yeah,
transplants and gone back to work.
Absolutely.
Got it. There's this one common myth again that only alcoholics need a liver transplant. You must have also heard it. What's your
Classic.
take on it?
கிளாசிக் ஸ்டாண்டர்டாக சொல்லுவாங்க, வெரி ஸ்டாண்டர்ட். சார் நான் தண்ணி அடிக்க மாட்டேன், தம் அடிக்க மாட்டேன், ஆனால் வந்து எனக்கு லிவர் ப்ராப்ளம் வந்துருச்சு அப்படிம்பாங்க. ஐ டெல் தெம் தேர் ஆர் ஹண்ட்ரட்ஸ் ஆஃப் காசஸ் ஆஃப் லிவர் டிசீஸ். ஸோ alcohol is one, but there are plenty causes. In our country, I think the next big issue is fatty liver disease. Okay. Data suggests that at least 20-25% of fatty liver disease will end up with cirrhosis or liver shrinkage. And if it decompensates, then we're going to end up with a transplant. So I think we have to be careful with the metabolic aspect of these things. Diabetes need to be under control. Food needs to be under control. And
No
of
food
course,
abuse.
No food abuse, obviously. And exercise, clearly.
Oh, very important.
Very
Yes,
important.
Missed out on that
Yeah.
point. Apart from this, the food abuse and taking care of the health and everything, are there any medical conditions that might also lead to a liver transplant? Apart from what we just spoke about, any other?
I don't understand what you mean by a medical condition.
Like
but,
if at all someone has high cholesterol or diabetes or anything like that, can that ever lead to a liver transplant condition?
Yeah, obviously. So diabetes is a risk factor for fatty liver disease.
Okay.
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 Hypercholesterolemia or high cholesterol,
Okay.
obesity, is a risk factor for fatty liver disease.
Got it.
Okay.
Okay.
So all these things can cause liver problem, and in the long run takes about 15-20 years for the liver to get fully shrunken, and then that needs a surgery.
Right. Okay. With so many myths that we've just discussed regarding liver transplant, is there any one proper source that probably the viewers can go and read or know on what are the myths, what are the do's, what are the don'ts about liver health and liver transplant? If you don't have the answer to this, I have the answer to this. But any one verified source that they can go read up on.
We are putting up a few information on our website, which they can go out to ChennaiLiverFoundation.org. We are also starting a liver support group, where we will be giving out verified information. We are going to let patients speak to each other, and thereby they gather that information, they gather the confidence, and also, some probably wouldn't have needed a transplant at all. How they overcome that bad situation and end up not having a transplant. So when patients speak, then the information is transferred more quickly. So we are also starting a liver support group very soon. The next couple of weeks we'll keep you posted.
Okay, that is wonderful. And for that, you know whom to follow. You'll have to follow his Instagram page and also the website, Chennai Liver Foundation. Yes. This support group, is it going to be online or offline?
It is going to be online. The first episode is going to be online.
Okay.
But we are going to start a WhatsApp channel and an Instagram handle where there will be two-way communication, and we will be sharing information. People can post questions, and we are happy to answer any number of questions and break any myths.
Okay, that will be wonderful.
Yeah.
Next, I want to ask is about the donors.
Yep.
Right? Again, from a common man perspective, I don't have much knowledge about this.
Yeah.
So first, I want to understand who all are eligible for donating.
So I'm just going to take one step back, okay, and then tell you about how we do the transplant.
Perfect. Yeah.
There are two ways of doing the transplant.
Okay.
The first one, which has stood the test of time and which is still very, very prevalent in the Western world, is cadaveric donation. When someone with a head injury or irreversible brain damage, is in an ICU, and then the family decides to donate the organs. You would have read this on the paper. Someone with a head injury decide to donate the organs. Lots of movements for organ donation happening. So people get confused with this donation and living donation. So cadaveric organ donation or brainstem death organ donation is when someone with an irreversible brain injury decides to donate his or her organs, where about 8 to 10 people can be benefited. Okay. This anyone can donate. Okay. I personally have retrieved livers from 4-year-old child to an 80-year-old grandmother. Okay. I've retrieved all these livers and we've used all these organs and they work very well. Okay. So my request to all the viewers is that, please pledge for organ donation. Please tell your family what your thoughts are. Okay. Of course, it's okay if you don't want to donate your organs. But I can tell you for sure that no religion, says don't donate organs. Okay. Let it be Muslims, Christians, Hindus, Jains, all religions support organ donation because at some point they will become patients. And then they would need an organ.
Yeah.
Right? So everyone should pledge for organ donation. Today, statistics say there are 25,000 road traffic accidents happening every year. Extremely unfortunate. I mean, I really don't want this 25,000 to happen.
Yeah. In fact, the statistics, even accurate one is every 4 minutes there's one road accident, and because of that road accident, the life goes.
Yeah. So it is very unfortunate that young people are losing lives. Okay, but and at some point, if they think of organ donation, in fact, I've told my wife that if something happens to me, I want to donate my organs. They should not be wasted. Why bury them or burn them when 2 lakh people are waiting for the organs? Okay, so that is one way of organ donation. where the entire liver is taken and it's given to a suitable match. Okay? The
Okay.
match is only a blood group match and a
Okay.
size match. You don't have to do anything else.
Okay.
Okay. The other way, because there is a huge demand in our country, as I said, about 2 lakh would need a transplant at any
Right.
one time. What we do is what we call a living donor, based on the property that the liver will regenerate.
Okay.
Okay, the liver will grow back,
Yeah.
right? So we take about, on average, about for an adult, we take 60% from a donor
Okay.
and remove the diseased liver fully and give that 60%, and the liver will grow back to both the donor and the recipient. Okay, so who can give? Okay, one, we have kind of an age group because we want the liver to regenerate. You don't want elderly people to give because the regenerative capacity in elderly people
Has
is less. So it's 18 to 50 because 18 is the legal age when you can consent.
Right.
Okay, it's 18 to 50, and it has to be blood group compatible. Of course, you can do blood group uncompatible, ABO incompatible transplants also,
Okay.
but ideally it has to be blood group compatible. We don't want obese patients, obese donors, sorry, because the liver will be fatty.
Yeah.
Okay, and we don't want diabetic patients,
Got it.
and they have to be related to each other
Why is being related so important?
because you don't want them to be misused.
Yeah.
Because
Okay.
to prevent organ trade.
Okay.
Of course, there are off late the last few weeks, the High Court has given various directives. But I don't know if you remember, after the tsunami which happened, a lot of people started selling their kidneys, yeah, for money. Okay, so the act, the Human Organ Transplant Act, says that you cannot sell your organs for money. Okay, of course, altruistic donations can happen. Emotional attached people can donate, provided the government authorizes it. Okay, there is a specific law which says that emotionally attached can donate, and we have to prove that it's altruistic. We have to prove that it's voluntary donation. You have to prove that there's no money involved in the transplant. Then this can happen. Otherwise, we safely stick to related donors. It could be any related donors, because otherwise the government will take us to task.
No, that's true. Brought a lot of light to this information. I want to understand how this donor is going to transition in his health. So, what are the things that he or she should take care of when they are donating and after they've donated?
That's very, very important because so we've had donors from 18 years of age. We've had even donations from to 52, 53 and all have donated. So what is important is they will get back to their normal life. You know, they will in about 4 weeks time they can
4
get back.
weeks?
That's all it is.
Okay.
They can get back to their work. They would not need any medication at all.
Oh.
But what they should understand, because the 4 weeks the liver is going to grow back to its normal size. Okay. But what they should understand is 5 years later they started to have a drink and they abused their liver. Okay. Or they become obese. Okay. Then if the liver gets diseased, okay, it is not the donation's fault. We have to understand that. Okay. So of course we in a living donor transplant, there are two components. One is the recipient and the other is the donor.
Okay.
The donor is the most important part of that component. We will never ever do a transplant harming the donor. Okay, we always make sure that every box is ticked, and we have to make sure that there's 100% success in the donation.
Okay.
Okay, if it's not fulfilled, then we're not going to do that surgery. Okay, so the donor is the most important part, and we have to make sure we send him out of the hospital well, which is about in a week's time.
Okay.
Okay, so after that, as I said, in 4 weeks they really get back to normal, and no tablets is required. But it's after up to them to take care of themselves. Of course, they can have they can lead a normal life, they can eat normally, they can do whatever they want. But obviously, any abuse is going to knock their liver off. So Prior to the surgery, of course, we've had people who've been on the obese side, whose BMI is over 30. We've had some vigorous weight loss programs, and then they've come for donation. We've had diabetics who has been reversed, and then they've come for donation. With patients who had thyroid problems, with high BPs who've come in, we had to correct that and then bring them for donation. So all these things can be corrected. Anything can be corrected. Of course, the donor should be compos mentis, as in, they should be able to consent. We've had enough number of instances where they come and say, oh, he's lying like a vegetable in the house, can you come and take half of the liver off? When patients in coma, patients who are permanently bedridden, so we can't do those things. They have to sign a consent form, they have to understand what they are going through, and they have to be prepared for the follow-up and all these things. Otherwise, it's going to be trouble.
Okay. Because you mentioned follow-up right now, why are follow-ups so important?
Follow-ups are important for both donors and recipients. Recipients, it's no-brainer. We need to know how the liver is working.
For donors, why is it?
Donors, we need to know that the liver is getting back to normal.
Okay.
Of course, when they are discharged in about weeks' time, most of these people will have a normal blood test. Okay, but nevertheless, we need to when the liver is growing. Okay, we need to make sure there's no other complication that's happening. One or two things might happen.
Right.
Not in every patient it will happen.
Right.
But once the LFTs or the liver function test is back to normal, we never do anything. After that, once a year, we do a blood test for about 5 years. We don't even scan them. If only there's any issues, we scan these people and find out. Because people time and again ask us, are you going to scan to see if the liver is growing? Okay, we don't do these things. So follow-up is important because we need to make sure that the liver is back to normal, because that's our duty.
Okay. And how long is this period of the follow-up?
So once discharged, in 7 days, we bring them back in a couple of weeks' time. We do a blood test. After that, what I do is I see them in 3 months' time again. And after that, 6 months, and then a year. After that, yearly blood test they do. That's all.
Okay. You spoke about consent, and then the donor has to be related.
Yeah.
And there can be emotional attachment as well. What is the health parameter that a donor needs to have, like fit, healthy? What are the checks that we do?
As I said, the donor is most important, and we do a lot of tests. The first thing which we do is what is the quality of the liver which he is having.
Yeah, very important.
And what is the quantity of liver which he can give, and what is the quantity which is we going to retain behind in the donor.
Okay.
So these are the things which we check. Okay, these are very, very important. Apart from that, we make sure he is not a diabetic, his heart is good, his cholesterol is normal, thyroids are functioning. Okay,
and age between 18 to 50.
Age between 18 to 50.
Okay. So these basic criterias, and plus about the liver health, that has to be on point.
Correct.
All right. The post-life for the recipient, okay, you mentioned the recovery, they can get back to a normal life post 4 months.
Yeah.
Okay. And this, after 4 months, when we say normal life, right, there might still be certain things that they need to avoid, like you mentioned, alcohol abuse and food abuse. But any other things that they need to definitely tell or no to?
One thing is for sure is that they need to stick to their medicines. Their compliance is important.
How long is
The
this
immune
medicine
suppression,
period?
lifelong.
Okay.
Lifelong. So the first 3 months there'll be a lot of medication, and for the first year there'll be about 7-8 medications.
Okay.
And for the second year, up to the second year, there'll be two drugs, and then after the second year there'll be one drug.
Okay.
Okay, but that's lifelong though, because that liver is foreign to them, and there's no way they should reject that liver. Okay, so medications is important.
Okay.
As I said, infections is quite common in our country, so they need to be quite careful. We've had lots of patients during COVID time, having COVID. That's a bit scary.
Yeah.
So infections are quite common. And of course, as I said, otherwise they should be able to lead a normal life. Blood test, we normally give them a calendar as to when the blood test should happen, and they should send it to us or send it to their coordinators or their surgeons. and that follow-up is quite important. So once the transplant is like a marriage to the surgeon. They're married for life. They like it or not, till their end. Then they have to be with us, and they have to keep communicating with us and seeing us for any issues. The other most important thing is they should not do any on over-the-top medications, over-the-counter medications.
Okay.
They cannot go to because we do so many transplants from villages and all these people. And headache, I have diarrhea, I have this, I have that. Can you give me some medications? So they cannot be doing self-medications.
Got it.
So it has to come through us because drug interactions are quite common in transplants.
All right. Can you tell me one case study of a successful liver transplant? Something that's like a core memory to you. Any?
Oh gosh, we've done.
Yeah, I know you've done so many, but
done quite a
any
few.
one that you will always remember.
So there was this one child from I think Mauritius. Okay, it's a small child. It's done I think 10 years ago. Child of a Navy personnel. So he came. We did the transplant, and then the child became for some reason unwell after the transplant. Okay, had some complications. And then of course the mother donated. The mother was okay, she recovered very well, but the child became a bit unwell after surgery. It's about week 10 days after surgery. And the father came to us and said, enough is enough. The child is suffering, we don't want this to happen, so we're going to pull the plug and I'm going to take the child back home. And I still remember, we standing in front of the ICU, literally begging him, just give us one more day, give us one more day. We know the child will come back. Child is a fighter. We had to tell the parents that, your child is fighting back. Of course, we had evidence that the child is fighting back. And though the parents were quite adamant that they wanted to take the child back, we fought with the parents, and we even had to waive off a lot of bills for the family, and then the child survived.
Did they?
So yeah. It's about 12 years now since surgery,
Wow.
and that thing we'll never forget. Never ever forget.
And now the child is healthy.
Yeah,
You're back there.
absolutely.
You still talk to them. You're in touch
Absolutely.
with them.
Yeah, of course, lifelong follow-up, as I said.
Yeah.
So what is important in these transplants is people always fear as to what is going to happen 5 years later, 10 years later, especially in children. Okay. Will the child get married? Will the child be pregnant? Can she can she become pregnant and have a child? Can she have, all these things crop up in their mind.
Yeah.
And villages over and over again, what they say is, that's okay, leave it. No, you can have another child. You are young. No, you can have another child. Just leave it. Why spend on this child? But I don't think that is the right thing. I think we should give the child a chance. And interestingly, pediatric transplants, the disease never comes back. Okay, once it's cured, it's cured.
Okay.
So if the child needs a transplant, it has to undergo a transplant because they live very well after that.
Okay. That's actually a very beautiful story.
Yeah.
So doctor, if I would want to become a liver donor, what are the things that I need to consider? Where is it that I need to sign up?
So I think this is what I was saying. No, it's confused between living donor and the cadaveric donor. So in India there is no system or there is no, for example, in UK in NHS there is a system where you can go pledge your organs in case of any eventuality. Okay, India doesn't have that system. Okay, there are n number of NGOs rooting for organ donation. They have their own database. Okay, but legally nothing's backed up. Okay, so I always tell whenever I give a talk, if at all you want to donate your organs, if at all you feel that you will have to benefit 8 to 10 people after the death, okay, tell your first family. That's the only thing that matters. If your first family is informed,
Okay.
that you'll want to do this noble deed, okay, because that will come to their mind in the time of crisis, okay, because that makes life for the doctor who is counseling that family a lot easier. They will think, she did
Yeah.
tell me that,
Yeah. Yeah.
so I really want to do
Absolutely.
this.
So, what final question is I have for you is liver transplant's future. How do you see it evolving? Where do you see this going?
I think transplants has been a game changer.
Okay.
Okay, as number of transplants is only increasing, number of units are increasing. But as I said, nothing major has changed in the last 30-40 years across UK, across US, apart from the number of transplants that's happening.
Right.
Slight technical modifications, some technological advances has happened. But what I really want to see and what will happen is the cost of it coming down.
Okay.
Okay, because that will benefit a lot of people. Okay, still it's exorbitant costs. It's only accessible to a very few. Of course, thanks to the government's initiatives, lots of people have got access to government schemes and government's funds also. But again, it's very very few. I think what needs to happen is more trained people need to come. Not only doctors. People always think one doctor is good enough for the entire time. It's a teamwork. It's a bunch of people who need to be trained. Everyone needs to be aware of the intricacies, the techniques, the complications involved in all these things. So I think I personally believe cost should come down. Then the number of transplants will increase automatically. Then the number of people benefited will be increasing automatically.
Right.
Then automatically your revenue and your economic growth will also happen. Okay. On one side, again, the other side, I think preventive hepatology or preventive medicine should happen. People should understand that they should lead a healthy lifestyle. They should
Very, very crucial.
alcohol in moderation, food in moderation, exercise every day. All these things should happen. Otherwise, I think it's going to be difficult. But I think we are going the right track. I think you see more and more gyms coming up. You see more and more people jogging and walking and exercising.
Definitely.
Things will change, but it needs to happen at a rapid pace.
Yeah. Yeah.
That's my wish.
What I fear is that actually that both the trends are increasing. If you see people who are adopting to a healthy lifestyle, that
Yeah.
graph is also increasing.
Yeah.
But people who are getting into the alcohol and food abuse that we spoke about, that
Yeah.
trend is also increasing.
Unfortunately, yes.
So this graph is not maybe as we'd expect it to go. But hopefully, as a trend, we've also seen for like starting, they are very crazy about partying and let's go and drink
Yeah.
and all those things. Eventually, after 2, 3, 4 years, they are bored. And that's when the factor that, okay, let's maybe start doing meditation, start doing
Yeah.
yoga, let's see what difference it's bringing, and then they get into the health aspect. So even if that happens, I think we are happy. Even the doctor will be happy with this if this change is incorporated.
Yeah.
But thank you so much, doctor,
pleasure.
for joining us today. A lot of decoding has happened. I've specially learned what liver transplant is, who can be a donor, a recipient, what all they need to do pre and post. I'm sure that there is so much more that we need to learn, but from a common man's perspective,
Yeah.
this information has been really helpful. So thank you so much. நீங்க இவ்ளோ இறங்கி இவ்ளோ simplify பண்ணி சொன்னதுக்கு it is very very helpful.
Yeah, I hope this is useful.
Yes.
These messages need to go through to patients.
Yes.
And transplant is not a bad thing. It's another form of treatment.
Exactly.
And patients are benefited. They live well.
Yes. Yes.
So
நீங்க சாவ போறீங்கன்னா தான் liver transplant பண்ணனும் இல்ல. That's a very very big myth
more
that
importantly,
we've broken
again, I really want to end saying, lead a healthy life.
Yeah.
No one should have a transplant. Yeah.
I like how a doctor is saying
Yeah.
that. With that, thank you so much, doctor, for joining. And we come to an end of the podcast. I really hope you've taken basket full of health information. And please stay tuned to our YouTube and our Instagram channel. The links will be down below for you to easily go access them and follow our foundation as well. Many, many more exciting episodes coming right for you. Thank you and stay tuned.